Now though, Dr. Hilary's here with today's health headlines. Hilary,
hi Christine.
You've got lots for us.
Well, everybody's read the headlines about Prince Philip
Yes.
today, I'm sure, who had a hip replacement yesterday at the age of 96, following the footsteps of the Queen Mother, who'd had a hip replacement at 95 and 97. Quite late in life to leave it until you have this major surgery. So, if people are wondering what actually happens, I've got a model here of a hip. And this is the right half side of the pelvis, and here's the top of the thigh bone. And this is the joint here. So the thigh bone has a ball here at the top, which fits into a nice little socket, and then you get a lovely bit of rotation, forward flexion, and the hip joint is very mobile. But it gets wear and tear over the course of time. Sometimes it can fracture across here or across here.
Definitely in 90-something years,
exactly.
You're expecting it, aren't you?
Exactly. So I imagine that Prince Philip has had quite a lot more pain recently and a lot of lack of mobility and movement. So what the surgeons do effectively is they cut the bone across there, and they remove the whole of this chunk of bone, replacing the socket here with a high-density polythene socket, and a metal shaft which goes down into this part of the bone and has either a metal alloy ball or a ceramic ball which fits into that plastic socket, polythene socket. And that reduces pain and mobility, increases mobility straight away.
Straight away.
They get the patients to stand up the same day.
That's remarkable, isn't it?
In many cases, or the next day. Today, I suspect Prince Philip will be encouraged to stand up and move, keep the muscles strong. Quite a few young people will develop hip problems for one reason or another, and these days hip replacements can last 15, 20 years because of the materials that they're made with.
Yeah.
The operation takes anywhere between an hour, hour and a half.
Yeah. So he should be back on his feet, we all hope, for the big day.
I
44 days away. Is that
probably
long enough recovery time?
I bet you it's one of the reasons he wanted to do it now. Knowing that in sort of 7 weeks or so, he'll be on his feet and ready to partake at the big wedding.
Or ready to party, rather, yeah.
Absolutely.